Hello, it's Dr. K from First Lake MRI, and this is a 42-year-old female with complaints of knee swelling and pain, and she has had the knee drained a couple times and the fluid just comes on back, and so she decided to get an MRI scan, and we see the problem on this lateral view. It's actually called a sagittal view, but it looks from the side. We can see the knee in profile like a lateral x-ray, and so this sagittal view of the knee shows the femur coming down here. We see the arrows pointing to the abnormality, which is between the femur and the tibia down below. To the left we see the kneecap, the patella, and the patellar tendon coming down here in the front. This is the quadriceps tendon here, and we see this white stuff here behind the kneecap. This is a joint effusion, a moderate to large joint effusion, and we see how white this is, very uniform, really bright, and this abnormal process here is more gray. So this is a region of synovial inflammation. We call it a synovial pseudomass. It looks like a mass, it's not a true mass, or localized nodular synovitis, just synovium that has grown, proliferated in a nodular area, and it will cause fullness, pain, can cause knee locking and limited mobility. And this patient, when the tibia goes outwards to extend the knee, it's right in there getting compressed. So this will limit the full knee extension and cause pain with extension. And this is the anterior cruciate ligament. The ACL comes down from the back of the femur here to the front of the tibia. And we see instead of being straight like the ACL should be, the ACL should go perfectly straight. We see it bowed back significantly because of mass effect by this synovial process. And this dark band over here, this is called Hoffa's fat pad. And Hoffa's fat pad, this process protrudes into the back of that fat pad. That'll cause abnormal pressure here in the front as well. And that is it. So she's got no meniscus tear, no ACL tear, no suspicious tumor, but she does have this joint effusion that keeps coming back and is related to this localized nodular synovitis, or this synovial pseudomass here in the midline joint. We can put up another view here, and we can see the process right here, and again you can see how bright fluid is, and this is bright but not quite as bright. You can see the gray in there. We could put up another view here. This is called a T1 weighted image. T1, fat is bright and fluid is dark. This is fluid in the knee, and synovium is more gray or intermediate. So this is a nice classic example of intermediate signal here, bright signal on the T2 weighted image here, and this goes along with a synovial pseudomass or benign nodular synovitis. And that's it. Thank you so much.